Hey guys, this is Nelson-Dooley, author of Heal Your Oral Microbiome. And we're talking today about how does the oral microbiome fare after gargling with antiseptics. And the answer is it really doesn't do that well. So we want to be a lot more thoughtful about using gargling solutions in our mouths. The default for all these years has been to kill all the bugs in our mouths, right? Use Listerine, use antibiotic toothpaste, destroy, destroy, destroy. But we really want to change our minds because it's the oral microbiome, all the good bugs in our mouths that actually can protect us from cavities, protect us from bad breath, protect us from gum disease. So we want to grow the good bacteria as a defense against the bad ones. So antiseptic gargles and mouthwashes are not a great choice for everyday use. Now, they can be helpful to fight lung infections. So the oral microbiome is tightly connected to the lung microbiome, and if we want to fight infections in the lungs, like pneumonia, it makes a lot of sense to attack infections in the throat using antiseptic gargles. But for an everyday gargle or mouthwash in someone who's generally healthy, we want to use gentle things like water, salt water, probiotic mouthwash or gargle, xylitol, aloe vera juice. These are some good choices for everyday use. Now, if there's an infection, you can make that decision that possibly a temporary antiseptic gargle makes a lot of sense to fight an infection in the throat or to prevent an infection in the lungs. And I do have recipes on my blog at healthfirstconsulting.com. This is the January 2023 blog on gargling. And there's 1% hydrogen peroxide as an option, 1% iodine. You can use Listerine. I would really consider using these temporarily, checking with your functional medicine practitioner or your functional dentist or biological dentist to make sure you're not overdoing it. Hopefully they'll be aware of the ecology of the mouth and the health of the microbiome. And of course, higher concentrations of these gargles are appropriate in patients who are very sick, very vulnerable, hospitalized patients, elderly patients, people at risk of pneumonia. There's a time and a place for these antiseptic gargles for them. And if you do have to use an antiseptic gargle, like I did when I had COVID, and I did use iodine gargle to reduce the viral load in my throat, you need to rebuild. You can rebuild the oral microbiome just like we do with the gut microbiome after antibiotics. So the way you can do this is to really hone in on your diet. Use a whole foods diet with plenty of plant foods, colorful vegetables and fruits, fiber. These are the things the oral microbiome loves to eat. You can take dental probiotics. Also, I really like Streptococcus salivarius K12 for throat health, for recurrent throat issues. This is a really good probiotic. And oil pulling is a nice option too, to cleanse the mouth without killing everything in the mouth. Okay, you can do probiotic mouthwash or gargle. Riven is our sponsor, and they have a really nice tasting probiotic mouthwash that you can use, and there's a lot of great evidence on these for balancing oral health and getting rid of bad bacteria and plaque. And then finally, if you have recurrent throat infections, sinus infections, lung infections, or mouth infections, then you really need to get to the root cause of it. You can look at the diet, and if there's a lot of junk food in the diet, we really want a whole foods diet with very low in sugar, low in refined carbohydrates. We want to get rid of allergens, things like gluten, dairy that might be causing immune reactions and enhancing the vulnerability to infection and boosting the immune system. So these are just a few things that you can do to improve your throat health. Antiseptic gargles are not the answer, and we have some good solutions here and on my blog. Please check it out, and thanks for watching.